The United States is a vibrant tapestry of cultures. This rich diversity is a source of strength, but it also presents a critical challenge for healthcare, ensuring equitable and effective care for all. This is where cultural competency comes in. Cultural competency is the ability to understand, appreciate, and interact effectively with people from diverse cultures. It's about recognizing that each patient is unique, and their cultural background shapes their beliefs, values, and experiences with health and illness. Cultural competence goes beyond simply knowing facts about different cultures. It's about creating a space where patients feel seen, heard, and respected. It's about building trust and rapport, which is essential for effective communication and shared decision-making. Ultimately, culturally competent care leads to better health outcomes for everyone. Cultural humility is a vital aspect of this process. It's about acknowledging our own biases and limitations. We must be willing to learn from our patients and their families, and we need to be open to different ways of understanding health and well-being. Competence in this context means developing the skills and knowledge to provide culturally sensitive care. This includes understanding different communication styles, health beliefs, and practices, and being aware of the historical and systemic factors that contribute to health inequities. By embracing cultural competency, healthcare providers can help dismantle barriers to care and create a more just and equitable healthcare system for all. The United States is in the midst of a profound demographic shift. The population is becoming increasingly diverse. By the year 2045, it is projected that no single racial or ethnic group will constitute a majority. This growing diversity has significant implications for healthcare. The Latinx population in particular is experiencing rapid growth, and Asian Americans are the fastest-growing racial group. The Black population remains significant as well. These demographic changes mean that healthcare providers will be caring for more and more patients from diverse backgrounds, and these patients will have a wide range of cultural beliefs and practices related to health and illness. This diversity presents both an opportunity and a challenge. The opportunity lies in embracing the richness and resilience of diverse communities, while the challenge is addressing the health disparities that persist across racial and ethnic lines. Healthcare providers need to be prepared to meet the needs of this diverse patient population. This requires a deep understanding of cultural competency and its importance in delivering equitable care. Meeting the healthcare needs of a diversifying nation requires a shift in perspective. We must move away from a one-size-fits-all approach to care. Instead, we need to embrace patient-centered care that is tailored to each individual's unique cultural background. This includes understanding their beliefs about health and illness, their preferred communication styles, and their experiences with the healthcare system. Despite advances in medicine, healthcare in the United States remains unequal. Health disparities are differences in health outcomes and access to care that are closely linked with social, economic, and environmental disadvantage. These disparities disproportionately affect racial and ethnic minority groups. Consider these stark statistics. Black women are 3 to 4 times more likely to die from pregnancy-related complications than white women. Hispanic individuals have higher rates of diabetes and related complications. Native Americans experience disproportionately high rates of heart disease and stroke. These disparities are unacceptable. These disparities are not random. They are deeply rooted in historical and ongoing systemic racism, including discriminatory policies and practices that limit access to quality education, housing, employment, and healthcare. Social determinants of health, such as poverty, lack of access to healthy food, and exposure to environmental hazards, further exacerbate these disparities. Addressing these disparities requires a multi-pronged approach. We need to dismantle structural racism and create a more equitable society. We need to invest in underserved communities and address the social determinants of health. And we need to ensure that all healthcare providers are equipped with the cultural competency skills to provide equitable and effective care to all patients. Only then can we begin to close the gap in health outcomes and achieve health equity for all. Section 4. Beyond Biology. Social determinants of health and their impact. While genetics and personal choices play a role in health outcomes, they don't tell the whole story. Social determinants of health are, the conditions in which people are born, grow, live, work, and age. These factors have a profound impact on health outcomes. They can be just as important as clinical care in determining an individual's health status. Consider access to healthy food. Communities with limited access to grocery stores or affordable fresh produce often rely on fast food and processed options. This can contribute to higher rates of obesity, diabetes, and heart disease. Safe and affordable housing is another critical factor. Living in substandard housing can, unfortunately, exacerbate respiratory problems like asthma. It can also increase exposure to lead paint and other environmental hazards. Education, employment, and income levels also significantly influence health. Individuals with higher levels of education tend to have better health outcomes. They are more likely to have access to well-paying jobs with health insurance benefits. Transportation can be a barrier to care, particularly for those living in rural areas or those who rely on public transportation. Missed appointments due to transportation issues can disrupt care plans and lead to poorer health outcomes. Addressing social determinants of health requires a collaborative approach. Healthcare providers need to partner with community organizations, social workers, and policymakers to address the root causes of health inequities. This includes, advocating for policies that promote economic opportunity, affordable housing, and access to healthy food and safe environments. By addressing these upstream factors, we can create a healthier and more equitable society for all. Section 5. Unmasking racism in healthcare. Bias, privilege, and inequity. We must confront a difficult truth. Racism continues to permeate healthcare in the United States. This is not always overt or intentional. It often manifests as unconscious bias, where individuals make automatic assumptions about others based on race or ethnicity. These biases can influence clinical decision-making, leading to disparities in treatment and care. For example, studies have shown that Black patients are less likely to receive pain medication than white patients, even when presenting with the same symptoms. This disparity is rooted in the false and dangerous stereotype that Black people experience less pain. Privilege, particularly white privilege, also plays a role in perpetuating healthcare disparities. White privilege refers to the unearned advantages and benefits that white people receive simply by virtue of their race. In healthcare, this can manifest as easier access to care, preferential treatment, and greater trust from providers. Recognizing and addressing racism in healthcare is not about placing blame. It's about acknowledging that systemic racism has created a system where certain groups are disadvantaged. It's about understanding how implicit bias can influence our actions, even when we have the best intentions. We must actively work to dismantle these systems of oppression and create a healthcare system that is truly equitable for all.